Ms. Williams, I'm Tara. I'm going to be your nurse practitioner today. All right, we're here to do a assessment on your hair, skin, and nails, and also we're going to be assessing your eyes, ears, nose, mouth, and throat. Okay?
Okay.
All right, let me sanitize my hands before we get started. I'm going to start with your skin, your hair, and the nails, and then I'll proceed with your eyes, ears, nose, mouth, and kind of work my way down, okay? Sure. First thing I'm going to do is assess your skin. Do you have any scars or abrasions or lesions?
No.
No. Any tattoos, birthmarks?
I have one.
Okay, one tattoo. And nothing on your upper chest or lower back?
No.
Okay. All right, so I'm going to move and check your hair. Now, when I check, I'm going to put my hands in your hair. I'm just going to be feeling and checking for texture, hair distribution, color. I do know that you have some dye on the ends of some of your hair. Okay, and I am going to check the temperature of your skin with the back of my hands. Just make sure you're warm. Also going to check your skin turgor to make sure you're well hydrated, and you are. Now I'm going to check your nails. I'm going to look at your nails. I'm going to be looking at the shape, the cleanliness of them. They're nice and clean. You don't have any hangnails or anything like that. I'm going to check your capillary refill. Got good color there. Okay. So now I'm going to start at your head and then work my way down, okay? I'm going to check your scalp. I'm going to be just palpating and feeling for making sure it's normal. As far as your skull, symmetry, no depressions or deformities. Everything feels fine. Now I'm going to start with your eyes. I'm going to be checking your visual acuity and then your peripheral vision. So the first thing I'm going to do to check your visual acuity, I'm going to have you, this is a Snellen chart. I'm going to have you look at it, cover one of your eyes and with one of your hands. Then I'm going to have you read the third to last line.
BPTZO.
Perfect. And then you will repeat the same thing on the other side. Now to check your peripheral vision, I am going to stand in front of you and I'm going to put my hands behind your head and I'm going to move them towards you. And they're going to be on the side of you. You tell me when you can start to see them.
Yeah.
Okay. Now I'm going to move them up and down. And I'm going to move them forward again. Tell me when you can see them.
Yeah.
Okay. Same thing on the other side.
Yeah.
Okay. Perfect. Okay. Now I'm going to check your pupils. Make sure I'll turn my light on. Check your pupils. I'm going to be checking the size of them. And then just making sure they're round, reactive to light. So look straight ahead for me. Good. Your pupils constrict once I put the light on them. Good. To the other side. Look straight ahead for me. Good. All right. Now I'm going to be looking at your conjunctiva. I'm going to make sure there's no swelling or yellowness or no foreign bodies. So I'm going to take my fingers and pull down on the inside or the bottom of your lower lids. Okay. No redness or swelling. Nice and pink like they're supposed to be. Excuse me. Now I'm going to look at your eyelids. Everything looks fine there. No swelling. Eyebrows are normal. No dryness. I'm looking at your nose now. Assess that. The shape is symmetrical on each side. I'm going to take my light and I'm going to look inside your nose. And the inside, I'm just checking for any swelling, any postnasal drainage. Do you have any postnasal drainage? Okay. So I'm going to take my hand and pull back on your nose slightly. Any tenderness when I do that? Right now, I'm just going to look in with the light. Okay, no swelling. Nice and pink in there. While I have my light, I'm going to go ahead and assess your mouth. So I'm going to look around your lips. Your mucosa is pink, normal. No scars or cracked or dry lips. So I'm going to ask you to open your mouth. I'm going to look at the inside. Check your soft palate, your gums. I'm looking for any dental caries. Looking at the base of your tongue as well. Now I'm going to ask you to stick your tongue out. Move it side to side. All right, perfect. Now I'm going to check your extraocular eye muscles. I'm going to have you look directly at my finger. You're just going to follow it with your eyes and not move your head, okay? So we're going to the right, top, down, back to the middle. Okay, perfect. All right. I'm going to go back to your ears. I'm going to move your hair out the way. I'm going to be looking at your ears. Just assessing the outside, palpating for any tenderness when I do that or touch your ear. Also going to do what we call a tug test just to make sure you don't have any tenderness. I do see that you have what we call a pre-auricle point right on the left side of your ear in the front. So now I'm going to look in your ears. I am checking to assess the tympanic membrane, making sure it's nice and white, no swelling or foreign bodies, and not make sure you don't have a lot of earwax in there. Okay, I can see the tympanic membrane. Everything looks nice. Not an earwax in there. I'm going to look on the other side. I'm going to pull your ear up and back and look inside. Everything looks nice and healthy in there. Now I'm going to switch my light to my ophthalmoscope. This light is, I'm going to be checking the back of your eye, looking at the blood vessels, looking at the disc in your eye, making sure everything looks normal in size and in color. So look straight ahead. I'm going to be looking in your left eye. I can see there are blue flecks. And I'm going to move closer to you and have you look directly into the light. Perfect. Everything looks normal there. Then I will repeat the same thing on the other side just to make sure everything is symmetrical. It's a Weber test. So I'm going to hit, this is called a tuning fork, and it's going to vibrate. I'm going to hit it together, put it behind your ear, and then you let me know when you stop hearing the vibration.
Stop.
Can you still hear it?
Yeah.
Perfect. All right. Next, I'm going to assess your trachea and your thyroid. I'm just going to be assessing for tenderness, placement, making sure it's symmetrical on each side. Feeling here on your neck. And then for your thyroid, I'm going to sketch you up a little bit. I'm going to check from behind just to make sure everything feels normal as well. Checking for any enlargement or swelling. So go ahead and swallow for me. Perfect. And now I'm going to continue to palpate and feel your lymph nodes. Okay. So we're going to start with your periauricle, and then I'm going to do your postauricle behind the ears. Move down to your then your submandible. And then I'm going to do your occipital behind your head. And then your anterior cervical. And then your posterior cervical. And then your supraclavicular lymph nodes. Everything feels normal. I'm testing or checking for any tenderness or swelling. And everything feels normal. And that about completes our assessment.